We have a special guest from T-Mobile with us today, which is contract of HPS. And today she's going to be, Dr. Christine Gull is going to present on the intersection of mobility and healthcare. So further ado, I'll let Dr. Christine take it away.
Thank you to HPS and to Nathan Stock in particular for the opportunity to speak to you today. Thanks also to those of you who are listening in to this recording. I hope you find this of value. Cellular connectivity has enabled innovation in the healthcare delivery space at an incredible pace. I'm here to talk to you about how wireless connectivity is becoming increasingly critical to the delivery of healthcare. Further, it is fueling the next generation of advances that are drastically showing how people access care. I'm going to share some emerging trends, also the impact of the COVID-19 pandemic on healthcare, and finally, I'll talk about how T-Mobile is supporting mobility for patients and providers of care, improving access for all. I'd like to start with just a couple of foundational slides to define the structure of a 5G network. From the beginning, T-Mobile has understood that a great 5G network would require an expanded spectrum portfolio, and that all three bands, low band, mid band, and high band millimeter wave, would be required. When T-Mobile merged with Sprint last year, the creation of a robust spectrum portfolio was the key driver to that decision. Let me define the capability of all three bands of spectrum for you now. Low band consists of spectrum under 1 gigahertz, which includes our 600 megahertz spectrum. Low band spectrum can travel hundreds of square miles, creating a wide footprint. Low band goes twice as far and 4 times stronger in buildings than mid band does. Because it penetrates walls and reaches deep inside buildings, it's better indoors than the other spectrum band options. It is also the foundation of our nationwide extended range 5G that is best used for wide open spaces, suburban and rural areas. And from a healthcare perspective, it's an important component of T-Mobile's spectrum strategy that enables us to address barriers to healthcare access and reach out to underserved people. Next, I'll talk about mid-band. Mid-band consists of spectrum between 1 gigahertz and 6 gigahertz. The 2.5 gigahertz spectrum, which was required through our merger with Sprint, has the benefit of being fast while also covering a larger area than the high band millimeter wave. Mid-band spectrum is best used for urban and suburban areas where high capacity and fast speeds are required. It is the foundation of our ultra capacity 5G network. And last, high band millimeter wave. Millimeter wave is defined as high band spectrum over 24 gigahertz. It gives you the fastest speeds, but doesn't travel very far. In fact, it only covers the equivalent of a couple of city blocks from a tower. And this can be problematic because it is easily disrupted by objects such as trees or walls or even glass windows. Because of this, it is best used for unique situations where high capacity is needed, like densely populated outdoor areas or indoor areas, settings where a single cell spot can cover many people, something like a sports stadium, for example. So that's my summary of spectrum. Hopefully that helps you understand and appreciate the rest of the conversation. This is a coverage map comparing 5G coverage across the three top carriers. T-Mobile's ultra capacity 5G covers over 150 million people today, and by the end of 2021, it will cover 200 million people. These maps clearly show the coverage advantage we have with our extended 5G range versus our competitors' low-band 5G nationwide footprint. Our low-band extended range 5G covers 295 million people and 1.6 million square miles. That's nearly 2 times the number of people covered by AT&T and 4 times those covered by Verizon. And for people covered with ultra capacity 5G, T-Mobile is also well ahead of the other carriers. Again, I just want to reiterate that the acquisition of the low and mid-band spectrum in the strategy has allowed T-Mobile to achieve this national 5G footprint. T-Mobile is committed to expanding this coverage map also. We aim to reach 99% of all Americans with 5G coverage by 2025. This broadband coverage is enabling T-Mobile to partner with healthcare leaders, with providers and payers to imagine and create innovative healthcare delivery options to address the growing demand and changing needs of consumers. So, as 5G starts to evolve in the future, what does our universe look like? Maybe it starts to look something like this. New network configurations that leverage fixed, mobile, and IoT cases. IoT stands for Internet of Things and is the sensors, machines, and technology that keep us connected and enable us to keep pace with the growing demand for increased speed, coverage, and low latency. There is a world of opportunity that will open with 5G. Think about all the devices, the sensors, and technology that you interact with in your personal and professional life. Think about the scale and the glucometer that connects your smartwatch to give you helpful information about your current health state, your blood sugar. And think about your doctor receiving that real-time biometric data so that they can better monitor your health status and plan for optimal health. Think about the last time you went to a store and a sign at the entrance told you to pause before entering because the store is currently at capacity to support social distancing. What about the news stories you've heard about surgeons who can operate on patients in different locations, in different buildings, in different states, even different countries? Or the neurosurgeon who receives images of a brain of a patient who is 80 miles away in the ambulance, and the surgeon can direct the EMTs how to respond to the stroke that they've just diagnosed after viewing the CT images real time. All of these scenarios require connectivity. The greater the need for speed, low latency, which means low lag, mobility, and the need to transfer huge data files becomes, the more important the 5G network is. So now that we have a basic understanding of 5G and how it interacts or intersects with healthcare, now we can pivot for the rest of the presentation and speak specifically about healthcare. The reason that I joined T-Mobile in March is that the opportunity to leverage the T-Mobile network to address barriers to care is a game changer to population health. 5G connectivity can, number one, improve access to care. 2, can neutralize health disparities that spread disease and illness disproportionately among the population. And thirdly, can reduce the prevalence of chronic health conditions in this country by giving people more timely, accurate, and complete access to healthcare. That was an opportunity that I just couldn't pass up. I'm here to explore the art of the possible with you today to improve access and outcomes for all. Let's talk now about some industry trends that are creating this perfect storm of opportunity in healthcare. The healthcare industry is booming while undergoing massive shifts driven by new players in the market, new stakeholders, complex technology ecosystems, and data interoperability. Keeping up with innovative care delivery is an increasingly competitive market. It is challenging, and there are consumer pressures for the need to keep up with delivering the best care possible at the lowest price. The industry is being driven in part by the rise of telemedicine, which grew exponentially when the COVID-19 pandemic propelled patients and physicians to adopt telehealth quickly. It's easy to see why this is a growing market. Telemedicine enables healthcare practitioners to better serve patients both inside and out of healthcare facilities across the globe. A new McKinsey report estimates that virtual visits could potentially account for 250 billion, or about 20% of what insurers pay in healthcare expenses. The healthcare industry is expected to grow to $6.2 trillion annually by 2028. Smart connected medical devices and the data they generate are fueling the booming Internet of Medical Things, or IoMT, industry. IoMT is growing with the uptick in wearables, remote patient monitoring devices, and other connected medical devices. Patient outcomes are improved because IoMT devices deliver more data more frequently to clinicians, and also behind the scenes, AI analytics algorithms help clinicians with early identification of declining health for greater timeliness and appropriate treatments for their patients. Emerging technologies like virtual reality, artificial intelligence, and robotic surgery will depend on 5G for all the things that I've mentioned previously. In the midst of these rising markets are three key things that industry is continually trying to solve for: improved patient experience, improved quality of care, and reduction in cost. The US, despite our leader in innovation in healthcare, have the highest costs and in some cases challenges with outcomes. And these are the things that we really need to impact to influence a shift in those numbers in the future. But it's one thing to solve for these challenges in a stagnant market, but healthcare is evolving at an accelerated pace. Healthcare organizations need to adapt to dynamic market forces in order to survive and thrive. Just maintaining a strategy that has created success in the past is not going to result in future success. In fact, it will and may result in organizations falling behind the curve moving forward. So let's get into some numbers that help us appreciate the rate of acceleration of telemedicine. Get the first number, 396 billion. The global telemedicine market size was 41.6 billion in 2019. But in the next 6 years, driven by the impact of the global pandemic, that market is expected to explode to 396 billion. Next number, 158 billion. According to Deloitte Consulting Group, with the IoMT, or Internet of Medical Things market, estimated to be worth 158.1 billion in 2022, an almost 400% increase in the last 5 years, it will be important for medical technology companies to focus on this important market segment to drive more value into the healthcare space in the future. Next, 19.5 million. The global medical device connectivity market is projected to grow at a rate of over 25% annually, reaching $19.5 million by 2026. And also, similar trends are expected in the global connected health and wellness devices market, according to a new report by Grandview Research Incorporated, estimating that that market will grow to $612 billion. Goldman Sachs estimates that connected devices could create $305 billion in annual health savings from decreased costs and mortality due to chronic illnesses. $305 billion savings by preventing illness and injury from happening altogether. And now we'll get into some specifics about how COVID-19 has accelerated the demand for telemedicine by consumers. This is a high-level summary slide of the influence of COVID-19 on healthcare's digital transformation strategies. Healthcare organizations are either accelerating existing plans or are adding new digital transformation projects to their strategy portfolio. The use of telemedicine, both in dollars spent and in provision of these virtual services, is also exploding according to the numbers. And innovation in medical devices that support remote care is also heavily in the news. Let's expand on these points just a bit, shall we? If you look at the left run chart, this is a great depiction of the acceleration in media attention to digital transformation over the past 5 years. And you can see the incredible punctuation of the sharp increase in that trend line throughout 2020, created by a need to look at care delivery in a vastly different way. The stacked bar chart or bar graph on the right shows in blue organizations that are currently working on digital projects, and in purple, those that plan to launch new projects across the 10 areas of digital transformation listed. You can see that in all but one area, 3/4 of healthcare organizations have strategies in this area of digital transformation. So the growth should be exponentially seen. The top 3 initiatives, artificial intelligence, cloud computing, and data analytics, all address the challenge of transforming copious amounts of data that practitioners are bombarded with and have access to into truly actionable sound bites of information. These digital innovations are essential to driving improvements in healthcare outcomes and in improving the health of the US population moving forward. In the next slide, I want to touch on the point of patient experience. Patient experience is also an area of priority for healthcare leaders. The advent of value-based purchasing, where patient experience data are used to determine how organizations get paid, has certainly contributed to this attention. But as you can see, the pandemic worked as another accelerator. The sharp decline in focus on patient experience in Q1 of 2020 is to be expected. It reflects the urgent shift in attention and resources from the executive teams at healthcare organizations to the need to stand up telehealth solutions. The speed of that response was certainly impressive, but once those telehealth strategies were developed, attention once again shifted to renewed and even increasing concern over the experience of care for patients. The bar chart at right shows the increase in attention from 2019 compared to 2021 in 3 key areas of patient experience. First, improving the experience of telemedicine for patients, the interoperability of the electronic medical record to ensure that workflows aren't disjointed during telehealth, and 3, improving communication systems for patients so that they may interact in a more timely manner with their care teams. One of the key drivers for attention to the patient experience of care is the rise in healthcare consumerism. The demand for information on cost of care, provider information, such as the number of procedures an individual provider has performed and the associated outcomes that they've achieved, and the rise in expectations that patients have a voice in decisions about their care have fueled the trend. These data clearly show that engaged patients have better outcomes. So this metric has become an important indicator for healthcare executives that they track on their key performance indicator documents, as well as for providers of care, payers of care, legislators, and of course, patients. This is another important trend to speak to. Unlike most other countries with a single payer system of socialized medicine, the US healthcare delivery system has substantially greater degrees of variation related to the third-party payer system. While many organizations follow suit on CMS coverage guidelines, payers have certain flexibility to develop their own reimbursement strategies. The increase in lobbying activity depicted on this slide from some leading institutions of healthcare attests to the fact that healthcare regulation and reimbursement are a key focus. They need to modernize to keep pace with the innovation occurring in care delivery in our industry. As an example, prior to 2020, there were no CPT codes, which are codes used by providers to bill for services, for telemedicine visits, and remote patient monitoring. That trend of developing reimbursement streams for telehealth and remote patient monitoring needs to continue so that care can continue to shift to home. Telehealth delivers lower cost methods of care that allow greater access to services and improved outcomes through timely identification of illness and disease and accelerated treatment to those identified health issues. Another area of reform has been the EMS system. CMS has launched a voluntary initiative called ET3, Emergency Triage Treatment and Transport. This program enables the capability to ambulance teams to evaluate patients on scene and determine the best level of care. Prior to this program, ambulances were required to transport patients to an emergency room, even when the level of care was not needed. This innovative project gives emergency providers greater leeway to provide on-site treatment and prevent an unnecessary patient transport, or alternatively, transport a patient to a location that is more appropriate to their condition, such as a physician's office or an urgent care center, or even a pharmacy. The pandemic clearly brought to the forefront social inequities that have contributed to barriers in social determinants of health for disadvantaged groups. Healthcare has become a visible platform for this divide and is getting much attention in the media, in the boardroom, and on Wall Street, as this graphic depicts. As I previously mentioned, reducing barriers in healthcare access by expanding the 5G cellular network and improving healthcare mobility expansion to underserved areas is a key priority for us at T-Mobile. Also, as I've previously mentioned, the acceleration in breakthrough devices and treatments that have been fueled by the pandemic is staggering. While there was a steady upward trend since 2016 in the development of medical technology, the first half of 2021 has seen these organizations stepping hard on the accelerator of innovation. And interestingly, even though there were many challenges to fundamental foundations of society, such as the supply chain, the pace of clinical trials registered through the government clinical trials website have not lost pace. I found this to be really an interesting finding. Looking at estimates of global distributions of profits in the digital health arena, you can see that all four sectors depicted here are expected to accelerate through the end of this decade, with remote monitoring and diagnostic and triage innovations leading the way. This is another area, another data point in support that bringing care to patients where they are, rather than patients being brought to care, is a trend that is expected to continue with substantial momentum. It also speaks to the fact that decisions about the appropriate level of care required to treat a patient will be increasingly made in non-traditional locations, more in home or on scene with emergency providers than in the emergency department setting, for example. Another trend, perhaps not surprising to some given the dollars involved, is the entry of big tech into healthcare. All 5 tech giants listed here have logged substantial investments in either partnerships or acquisitions to create a foothold in the healthcare space. Google has partnered with HCA Healthcare, the largest for-profit healthcare organization in the country, to use their patient data to develop AI algorithms to improve efficiency, timeliness, and accuracy of care. Amazon has inked deals with several enterprises to provide their on-demand health service, Amazon Care, to the public. Microsoft is making inroads in healthcare by improving digital health data storage for customers in Europe. And Facebook is striving to improve healthcare literacy through social media and behavioral science applications. Apple is rumored to be exploring non-invasive blood glucose monitoring and blood pressure measurement in future iterations of its Apple Watch. This is all a signal that the siloing of healthcare will become more integrated into other aspects of a person's life in the future. It is truly a remarkable time for innovation in healthcare. And these developments that I've just mentioned to you are just from the second quarter of 2021. Last night, as I was listening to the news, I heard that Epic, who is an industry leader in the electronic health record arena, is going to be partnering with Walmart on a novel strategy for access to healthcare. Just imagine getting a procedure done while you're doing your grocery shopping for the week or while you're waiting for your tires to be rotating. It's simply amazing what the future holds. I'd now like to spend some time talking about how 5G will power the innovation and mobility in healthcare that I've been speaking of. Here are a few emerging cases. First, remote health. As technology and networks mature, healthcare will move into the homes for patient comfort and convenience. 5G can fuel remote health monitoring, robotics, and powerful analytics, which could help patients facing long-term illnesses get quality care from the comfort of their home. 5G's high-speed, high-bandwidth data transmissions could one day help healthcare providers monitor patient diagnostic information in real time. Wearable fitness and medical devices increase patient engagement in their health and treatment and adherence. Imagine having your own personal health coach avatar to help you achieve and sustain optimal health. It's an example of remote health in the future. Wearables and IoMT is another area of future and emerging use cases. 5G high-speed, high-bandwidth data transmissions could help healthcare providers monitor patient diagnostic information in real time. Wearable fitness devices, again, increase patient engagement, as I mentioned before. And for those of you listening to this webinar, how are you accessing the Internet of Medical Things? One of the fascinating parts of my job is that I get to meet with inventors and entrepreneurs about their latest medical devices. Let me give you an example of a unique innovation. It's a bodysuit that contains sensors that can measure exactly where one's body is in space with GPS tracking. Think about the opportunities here. Imagine you're recovering from traumatic injury and your therapist trains your suit to recognize the perfect motion for each of your rehab exercises. And the suit gives you real-time feedback as you accomplish your exercise goals for the day on how you can improve the impact of your rehab training. In-home, low cost, improved outcomes. Next, digital rehab. Similarly, healthcare organizations can one day use augmented reality and virtual reality applications for things like fine motor skill training, gravity compensation exercises, and tailored video programs. 5G's lower latency may remove the lag effect of these applications, improving the experience and speeding up the time to recovery through improved patient adherence with the rehab plan. And last, radiology. High-speed 5G networks will support the transfer of large data sets nearly instantaneously, including large medical imaging files like MRI and PET scans. Imagine being able to have a CT at the accident scene. Imagine a trauma surgeon receiving and reading the films in minutes, and the patient being cleared of internal injuries, treated at the scene by the EMTs, and able to go home to recover. That's the future. Two other areas, telesurgery and robotic surgery. The robotic arms used in remote control surgery will need 5G's future state ultra low latency to operate with precision. Surgical robots may also need 5G's high speed and large data transmission potential capabilities to process camera imagery. And all this, talking about decentralized healthcare, as robotics and telesurgery mature, healthcare organizations could unveil things like telehealth kiosks, where they have automated ability to do increasingly complex procedures. So now that I've talked about the emerging use cases, I'd like to talk to you a little bit about some real projects that we at T-Mobile have been working on with our colleagues in healthcare. Working with the U.S. Department of Veterans Affairs, we're supporting access to care for 70,000 veterans living in rural areas in the country. Another area we're working on, T-Mobile has partnered with Catalytic Health Partners to leverage IoMT, the Internet of Medical Things solutions, connecting providers with patients in their homes, again, bringing care to the patients rather than patients to care. Another area, we are working with, we have ongoing relationship with students at the University of Kansas who are exploring new uses for 5G technologies to address challenges in distance learning and in improving workflow for nurses. And partnering with Easter Seals of Southern California, we're giving people with disabilities the power to communicate in innovative ways. If I've achieved one objective in our time together today, I've painted a picture that the way we have previously accessed care is going to look very differently in the coming months and years. The COVID-19 pandemic has fundamentally tilted the world of healthcare on its axis. This is a time of tremendous change, growth, and innovation. I encourage each of you to think about how you personally access healthcare, how you professionally deliver services to patients, and then take a step back and think about the art of the possible. The pace of innovation and indeed transformation is accelerating. The attention of both public and private sector is on healthcare, committed to ensuring that we create new lanes of services that are responsive, flexible, and mobile. This is truly a time for imagining, then creating the future of healthcare. I hope that you have found this information I have shared insightful and enriching. Thank you again, Nathan, for inviting T-Mobile to participate in this fantastic new webinar series. If you have any questions, I've provided my email address so you can connect with me offline. I leave you with one of my favorite quotes. It is, "How wonderful it is that nobody need wait a single moment before starting to improve the world." That is a quote from Anne Frank. Thank you for your time and interest. I hope that this webinar has inspired you.